Lawrence Memorial Hospital now brings you better health.
Usually someone will have a history of having stones or some sort of gallbladder pain in the past, and then they have a really, really bad episode that brings them in. A pain that gets worse and worse and worse is something that you should go in and see for. If you have a pain that kind of comes and it kind of goes, it may be from your gallbladder and it may be from stones, but it's not necessarily something dangerous. It's definitely frustrating and painful, but probably not dangerous. But pain that gets worse and worse, and you feel really sick, then that's when it's time to go in and get evaluated. There are a lot of things that can cause pain here that's not the gallbladder. It could be something as simple as constipation. It could be something like an ulcer. It really comes down to how much it bothers you. If you have some gallbladder attacks and you get a little bit of pain twice a year after eating your Aunt Marge's lasagna, then maybe you should stay away from lasagna. But it really, people who have severe attacks and it really impairs their daily life, they can't eat, sometimes can't even drink, which is rare, but they want to get back to living their normal lives. And then if they want to get their gallbladder out, and it's a reasonable thing to do, the next thing you have to really consider is them as a patient. How fit are they for surgery? This kind of standard old-fashioned approach is what we call an open cholecystectomy and making an incision underneath the ribs and taking your gallbladder out that way. And that's the old-fashioned way of doing it and the most invasive way to do it. The less invasive ways and kind of standard of care is laparoscopic cholecystectomy, which is taking your gallbladder out usually from a small incision around the belly button and then 2 or 3 other holes underneath the right side of the ribs. And then there's also ways to do it with one single incision, usually through the belly button, and also robotically. And I think from a technical standpoint, as far as safety and overall outcomes for the patient, I don't think you can go wrong doing any minimally invasive technique. Patients who get their gallbladder out usually go home a couple hours after surgery if they have it done laparoscopically or robotically. Patients who get their gallbladder out through a big open incision stay in the hospital a few days. My philosophy is that a lot of times less is more. We like to do minimally invasive laparoscopic surgery. I think the less trauma in general that you can do, the better, and that's why we use smaller instruments and do a lot of procedures laparoscopically. And that's one thing that all patients have to understand, is that if you have a laparoscopic procedure done, and it doesn't matter whether it's getting your gallbladder out or a colon resection or a hysterectomy, any laparoscopic procedure, there's always a risk of converting to an open procedure. But the key question is, does someone need surgery in the first place? There's a big difference between an indication for surgery and whether or not someone should have it. And that's a key thing that I discuss with my patients. Just because you have an indication or a reason for surgery, is that the best thing for you to do? And a lot of times surgery is a last resort, and a lot of times it's necessary. But the decision to have surgery is not a decision that I make, it's a decision that we make together. I've been at a lot of different hospitals, and it's really a special place to work. All the nurses, all the doctors, everybody really truly just puts the patient first. And I think everybody here just has a positive attitude and really wants to take good care of patients. And I think that the top 100 hospital is a well-deserved thing, and I couldn't be happier here. I've had family here, I've had friends' families here, and I think they came to a good place.